And welcome back. Welcome to our Medical Minute today. We just wrapped up National Stroke Awareness Month, but its prevalence does not go away. The CDC reports nearly 800,000 people have a stroke in the United States each year. And joining us this morning to talk about stroke awareness, we have Dr. Deepak Nair, a neurologist with OSF Healthcare's Illinois Neurological Institute. So good morning, Dr. Nair. Thanks for coming in.
Thank you for having me.
Of course. So a pretty important topic here. Let's talk about just what is a stroke and how does it happen?
Sure. The easy way to think about stroke is that it's the clinical signs and symptoms that we see due to disruption of blood flow affecting either the brain, the retina of the eye, or the spinal cord. And there's two different sort of classifications of stroke and subsections of each of those, but it's either because there's blockage of blood flow into the brain or there's bleeding into or around the brain.
Okay. And how would someone know if either they or someone around them is having a stroke?
Perfect segue. So the way we teach to recognize the most common signs and symptoms are the acronym FAST, or what is now more recently we've added on BFAST. So these are the most common signs and symptoms. So FAST stands for face, arm, speech, and time. So if you have weakness, especially of one side of the face, arm weakness, especially on one side, a change in your speech pattern, either because it comes out incoherent or garbled, or you're not able to get words out, and then T for time, because time is brain. The B and the E were added more recently because a lot of patients with stroke can also have problems with balance or eye movements.
Okay.
And so B fast is an easy way to recognize that.
Okay. And I know you mentioned a numbness on the side of the face and the arms. Would that be the same side of the body?
Usually affecting the same side, because for the most part, the left half of the brain controls the right side of the body and vice versa. But the brain's complex, and so depending on where exactly in the brain the injury is, you could see some differences.
Gotcha. Okay. Very insightful. I did not know that. That's good to know, though, especially the acronym. That really helps.
Yeah.
So that's wonderful.
Yep.
I'm glad you guys came up with that. That's
well, I can't take credit, but we do use it a lot, yes.
Right, of course, of course. And is there any research or treatments going on right now that are working to prevent strokes?
Yes. So here in the last 20 years, actually now coming close to 30 years, we've had opportunities to implement emergency treatments to try and minimize the damage from a stroke. The earliest option there is a drug called TPA, which is a clot buster kind of drug to help break up blood clots that might be blocking blood flow. Not too long after that, we started introducing catheter-based treatments where you can insert a catheter through the arteries directly into the brain and physically remove clots. If you have aneurysms, we can treat those aneurysms that way, and lots of other types of procedures. So those are still the main categories. Now there's a newer TPA type of drug that's been approved for stroke. And most stroke centers have made that transition, and a growing toolbox of catheter-based devices as well.
That's good. So we're making progress in treating and hopefully preventing strokes in the future.
Not as fast as we would like, but certainly we've made a lot of progress.
Well, that's good. Progress is good.
Yes.
Even slow progress is some progress.
Exactly.
So that's good.
Exactly.
Well, that's great information, really insightful. We do have a full-page screen with websites and information here.
Yes.
Is this where people can go to?
Yes, absolutely. That's our internal website for our stroke program. There's a lot of the same information we just talked about. The other place I would recommend is the American Stroke Association. You could Google that and find it easy.
Awesome. Well, thank you so much, Dr. Nair, for coming in. Great information for us.
My pleasure. Thank you so much.
Thank you. And stick with us. We'll be right back.